I'm Andrew Satz. I am the CEO and co-founder of Evolve. We're an AI plus drug discovery company. We use AI to accelerate the speed at which drugs are discovered. We're actually working on a coronavirus drug right now. And I feel very fortunate to introduce our panelists. Naj Austin is the founder and CEO of Ethel's Club, which is a private social wellness club with people of color in mind. Jared Friedman is a partner at Y Combinator, which is an incubator for seed stage companies. And LaToya Thomas is a digital health policy expert and director of policy and government affairs at Doctor on Demand, which is a telemedicine company. So thanks so much, guys, for being here. So I'm just going to jump right into it. How has COVID-19 really changed your business operations, or in the case of Jared, how has it changed your startup or portfolio company's business operations? If you want to take that, Jared.
Sure, I can start. And thanks very much to Andrew and the folks from Columbia for having us here. Well, COVID had a direct effect on Y Combinator, actually, because Y Combinator runs an in-person program where founders come to the Bay Area from all over the world, and we host a lot of in-person events. And of course, all of that has had to go virtual starting in March, which has been a really new experience for us and something that honestly we're still trying to figure out. The way Y Combinator works, we run 2 batches of startups per year, and ordinarily they all come to Silicon Valley for the program. This summer, we're going to run, for the first time in our history, an all virtual batch where the founders won't move. They'll take part in Y Combinator from wherever they are in the world, which is definitely going to present some challenges in terms of how do we replicate like the true in-person feel of the program. But I also think some opportunities, because it, I think, is going to make it a lot easier for international founders and founders that aren't in a position to move to Silicon Valley to participate in Y Combinator. So I'm excited to see that.
Cool. How about you, Naj? How's it affected your business operations, and what guidance are you giving to other people around the changes that you're experiencing and how they can think about it, especially since you're part of a community-based business?
Yeah, so very similarly to Jared, our entire business model was built around, people of color having a safe space to gather. And very quickly that had to come to an end. One of the things about being a venture-backed company is that we were always planning on having a digital component to the product. It was definitely pushed out for like 2022 Q4, and we had to sort of ramp it up for today. But we had such a strong sense of community here with our members and with our brand across the world that, again, very similarly to Y Combinator, once we launched a digital membership, we were able to bring in members who don't necessarily live in Brooklyn to be a part of our community. So that's been really interesting to kind of see the things that we've done here replicated online, and to that people are still responding positively to it. In terms of guidance, I don't know if I necessarily have any. I think sort of taking one day at a time and being really open to learning has gotten us where we are today. Every time we have an event inside the digital clubhouse, we have events 3 times a day at 9 a.m., 3 p.m., and 6 p.m. Eastern Standard Time. We learn whether our members are more interested in learning how to finance their lives in this time, if they want a place of respite and away from sort of the traditional news outlets and kind of away from COVID, whether they're looking for workshops or whether they want to just hear a DJ set. So it's constantly a learning battle. And I think my team and I have just learned to sort of lean into the unknown and sort of build with what we're being given every day. That's sort of how it's shaken out for us.
Yeah, it's great to hear that there's some positive changes and being accelerate the tech as well. So it's nice to see that it's sort of like not the total shutdown that we're seeing a lot of organizations.
Yeah, definitely. I mean, my investor update, I think it was probably one of my most well-received ones. They were like, finally, like we were waiting for you to kind of bring in the tech. So that's been exciting. I mean, mainly just from the standpoint of building with technology, it enables you to do so many things.
Right.
So it's been fun. It's been weirdly fun amid all of the chaos that is happening. It's been nice to have something to build.
Yeah. And for you, Latoya, I mean, I'm assuming since you're in the health space, your company's in the health space, and telemedicine is really ramping up. You know, we'd love to learn more about how it's changed your business operations, but maybe something that's been unexpected that has changed, and sort of how you've handled it.
No, those are great questions. I can tell you I've been doing this work for over a decade, and I never thought that I would see the day when a federal official at such a top level would be in a position to promote, endorse, and validate telehealth at the level that we've been seeing on a daily basis. And so it's been nice, it's been affirming. It's also been affirming to see state governors come out and check each other and say, you know what, if you haven't necessarily gone through all of your state policies to see if there are any existing barriers at the state level for your healthcare providers as it regards to telehealth, you should probably take stock of some of those policies and do everything that you can to remove them. So it's been a really great regulatory space right now for virtual care. I will say that because Doctor on Demand, because we're a little unique than some of the other telemedicine companies, in that we employ our healthcare providers, and we had already scaled efforts to all 50 states and DC pre-coronavirus. And so we already had a presence with licensed healthcare providers for primary care, urgent care, and behavioral health. We were ready. We were probably more ready than others just because of the nature of our clinical operations, but also the strength of the telehealth platform and integrated electronic health record system that we created ourselves. I think what we were really welcome to see, and I can just talk a little bit about the policy space, was just the removal of barriers for us to be able to service roughly 38 million Medicare beneficiaries, and we hadn't necessarily been able to do that before because of discriminatory policies that prohibited us from seeing folks who are in non-rural areas, and also from policies that prohibited us from seeing those same patients in their own homes. Now that we have about 42 states that have stay-at-home orders, not only being able to support the mitigation requirements that are being promoted by the CVC and being able to see some of those patients in their homes, we're also being able to provide routine primary care and behavioral health care. Obviously, social isolation can lead to depression for some, maybe increased anxiety for others. And so it really has been really great for us to be kind of integrated into a larger healthcare system and provide much more robust care than I think folks previously thought that telehealth could provide.
Yeah, it's great to see that we're starting to see those breakdowns in that regulatory resistance. I knew it was always such a good thing to see that telemedicine was available, and then such a terrible thing that it was like the resistance was not so much the providers or the patients, it was really the system that was getting in the way. So it's really great to see that you're seeing the breakdown of barriers, and also the breakdown of barriers of video chat, right? Like, so these video meetings and how they've been really positively impacting, and in some cases negatively impacting, but that sort of transformation of business to having more video conferences, to have those conversations where a lot of times it was before you need to come in person to see me. So it's really great to see that change, and everyone sort of accepting that your kids or your pets might be in the background. So so you know, a lot of startups, regardless of the industry or the business model, are really about unifying culture and community. But you know, work from home and social distancing really physically pushes us further apart. So these are really conflicting ideas. So how are you guys dealing with this this process, either you know, within your portfolio companies, within your businesses, or within the way that you operate your lives? Naj, you want to take this one?
Sure. Yeah. I mean, our entire business model, again, is around sort of creating culture and community for people of color. I think that what we found is that people are seeking connection more so than ever. And people are also seeking any sort of practice that they can turn into a habit. I think there is so much chaos and so much unknown that they want things that they can depend on. So when we launched our membership, it wasn't so much about trying to just provide this place. It was about providing a place alongside some structure. So the structure of the events being a thing that you can depend on every day was really important to our model. And very similarly to the clubhouse, where we had scheduled programming every day. So even if you worked here or came here for meetings, you would be able to depend on us having mental health therapists come by at 12 and or an event at 3 p.m. So really trying to keep that spirit alive as much as possible. We've had a couple of different members reach out to us for support groups, which is not something that I thought people would want from us. You know, we're sort of like a fun place where you can see a DJ set and sort of be in a group therapy session, but it's turned out that people are turning to us for a lot more. So it's put us in an interesting position to make sure that we can constantly provide it. And I think also kind of stay on our toes and be nimble for whatever our community does need. Because, you know, again, I would not have thought that that was the outcome, but, you know, we want to always be a company that can do whatever our customers need.
Yeah, and I think it's probably sticks very well to what your grandmother wants, you know, Ethel wanting that. So creating that community, it's super cool, right?
Yeah, and I think it's been great. Again, to see it kind of happen online, because the community here in Bushwick and Brooklyn was very, I wouldn't say specific, but I mean, you had to live in Brooklyn, so there, or New York City, so already it's kind of specific. And now it's sort of this combination of people dealing with what's happening and coping with it all over the world. And to see us all kind of going through the same thing, I think is very unifying in a way.
Yeah, absolutely. So, Latoya, you know, we've seen this, obviously, this incredible ramp up in telemedicine, but even more interesting is we've seen this incredible ramp up in telemedicine reimbursement, which is sort of the extra layer that was missing. But then also the FDA is performing, the Food and Drug Administration is performing these unprecedented review times of 24 hours. Did we lose Latoya? Because is she frozen? Or is it just, all right, well, I'll jump ahead then. And when we get her back on, I'll ask her the question. So Jared, so Credit Suisse very recently surveyed consumers in China, and I mean very recently, and asked them coming out of the event, of the coronavirus event, what are the things that they were most likely to spend money on going forward, and what are they less likely to spend money on going forward? And so the top three answers were more spending, or top two answers were healthcare and education, and the less spending were dining and travel. So given the viral nature of pivoting, and excuse the pun, how do you think health tech needs to pivot to respond to the current and upcoming new normal?
Yeah, I saw that Credit Suisse poll. That's interesting. One thing I wasn't sure of is I wasn't sure if people were saying that because sort of they were still worried about coronavirus and they were saying, well, in a world in which travel is dangerous, we want to travel less, or if the way the question was worded was like, after all of this is over and life returns to normal, what do you want your spending habits? Do you expect your spending habits to be there? I don't know if you were able to figure out.
You know, it was really hard because
which one they actually meant.
The survey was written in Chinese. So it was like, I don't speak Chinese, so I don't actually know. I had to go based upon some person's interpretation. So I played the telephone game on that. I know that they asked these questions, but I mean, it seems to make sense that people are spending a lot more money now on health and education, right? So you're seeing all ed tech startups blowing, you know, shooting out like through the roof. And then the health, you know, all the online yoga, and I'm sure, you know, Naj is sort of experiencing that with the sort of the health of people, whether it's their mental health or their physical health in the community that she's built. But I'm curious to sort of thinking about how companies that are doing healthcare right now, and the health tech companies, where you see, especially since you look at so many different organizations and you've seen so many companies pivot, especially since you're starting at the seed stage, how do you think like companies now need to pivot to respond to what is currently happening, which we obviously are seeing, but maybe the upcoming new normal? I mean, I know it's very hard to look in the future, but as you know, as YC, you're looking at seed stage companies with the assumption that they're going to do something later. So you are to some extent peering in the future. So.
Yeah, so I think one interesting trend that we've seen is the number of health tech companies that have actually like redirected their business focus their business focus and repurpose the technology that they've been working on for years to fight the current epidemic. So we have companies that were working on tests for other diseases. Now they're working on tests for COVID. We have companies like yours that were working on drugs for other diseases, and they're like, cool, we can use the same technology for drug discovery to discover a drug for COVID. And then we even have sort of like more dramatic pivots where we have companies that had a factory to build, sweatshirts, and now they're building face masks, or how they're making face masks. And so I think it's been really inspiring for me personally to see the way that the startup community and the health tech community has sort of rallied to the cause here. And I don't know what's going to happen when hopefully the world gets back to normal, but I hope that we're able to retain some of the sort of community spirit that we got, and the spirit of working together to fight a common cause.
Yeah, so I think that's very interesting to say, because that common cause is going to go away at some point, right? That common challenge is going to go away, or it's going to get to a point where we're going to be re-entering to some sort of, I wouldn't say new society, but new version of the lives that, it's not going to be what we had. Change is going to happen, right? Whether it's we see more people interacting online, or we see, we can see these broad communities, and Naj's community moves outside of just being in Brooklyn and becomes more of a world or a national world community, where maybe people who are really interested in Brooklyn can actually become part of that community, but they don't have to live there. Right. And so, from your perspective, Naj, where do you see your own organization trending at, like, if you're thinking ahead to when this is over, what you think the world will look like? Because I think we all have our sort of own perspectives on what it is. I'm much more optimistic about what the world will look like, right? Although I'm concerned about, like, people just, even after everything goes on, and people giving me dirty looks in the grocery store when I get a little too close to them, right? So I'm curious how you see it, and how you're thinking about your organization post coronavirus.
So we're thinking about a lot of things. And I think a lot of that is born out of not knowing what's next. So everything seems plausible and feasible, and like it should be built. And so I think our biggest conviction is that sort of the same conviction we always had, which is that people of color are struggling to find space. And that was the original thesis of what Ethel's Club was. We always wanted to be a place that provided every answer that a person of color would need, whether it was, where can I buy a product that's meant for me? Where can I, shop that's meant for me? The clubhouse was meant to be our laboratory to test a lot of that out, right? We have a marketplace here. We'd bring in vendors to see what people responded to. And so we're really just shifting all of that online. We're really becoming a resource and a directory for anything that centers and celebrates people of color. But again, removing that focus of New York City, where we're super focused on, and now saying, what about if we could provide a directory of every mental health practitioner that is a person of color in the world? Definitely not starting there, maybe the US, but trying to think enormously, because now the problem is that big, and now our audience is that big. And so trying to make sure we can be responsive to them. People have asked us all kinds of things, and I'm just sort of we aren't the best company to answer that question right now, but should we be? Can we do that? And so we've had a lot of meetings the past 2 weeks about positioning ourselves as the end-all be-all for answers revolving around the celebration of people of color, and how can we do that? Because I do think on the outside of this, people's values, which I think have dictated consumer behavior for a long time, obviously, and definitely now, will change, and we want to be on the upside of that. And so I think just thinking bigger today versus again in my deck where it was 2022, and trying to kind of reposition that. And so I've always had an appetite for crazy, insane, large ideas. I'm let's reinvent the internet. But now I'm well, we've got some time, maybe we should. So I think just thinking bigger has been the biggest change.
That's really interesting. I like hearing that. And I think it also talks a little bit to the idea that we're seeing, like, besides the changes of the communities and how we're interacting with one another, but having this big idea of how do you create some positivity out of this experience, right? So I think there's a lot of people who are very worried and have a lot of anxiety, but to create the positive outcomes, right? How can we level up as human beings? I think it's really beautiful that you're actually pushing that and really trying to help beyond the local community, which is great. I mean, I think it's amazing that you're helping the local community. But so now that we have Latoya back, I'm going to hop back to the question I was on. Welcome back, by the way.
Thank you.
So we're talking a little bit. I was talking a little bit earlier about the idea that you were saying that you're seeing a huge ramp up in telemedicine, but what that also corresponds to a huge amount of reimbursement, right? So you're seeing the Centers for Medicare and Medicaid starting to reimburse telemedicine in ways that they hadn't maybe as easily reimbursed them before. But at the same time, we see other types of regulatory changes. So, for example, I'm in the drug space, and the FDA is performing unprecedented review times, like within 24 hours. So you have a drug or diagnostic for the coronavirus, they'll review your application in 24 hours, which is insane, considering the bureaucratic nature of these things. And some U.S. government agencies that are issuing grants are getting grants out in under 30 days, which again, insane, like, time acceleration. So you're seeing a lot of things are quickly happening when it comes to how healthcare companies interact with the government, insurance companies, and regulatory authorities. How do you think these what do you think about these positive and negative regulatory changes, and where do you see them? Where do you see maybe, like, right after the coronavirus ends, and how are you guys navigating these changes? So, because it's very rapid, and regulatory changes are never, they're never this fast, ever.
Yeah, they're never this fast, especially in healthcare. I mean, healthcare is probably one of the more highly regulated spaces that you can think of. And those are all really great questions. I guess I could, given my technical issues, I'll start with the $300 million investment from the FCC to support broadband connectivity and the use of connected devices to healthcare providers. There were two programs that were approved and appropriated from the CARES Act. That was the $2 trillion legislative package that came out and signed by the president just a few weeks ago. So I think there was this understanding that our current broadband and wireless infrastructure was inadequate to kind of support the kind of scale that was needed today, but also to support the efforts of continuing virtual care post-COVID, whenever that is going to be. So supporting many of those healthcare facilities that are trying to adopt and integrate virtual care systems into their own practices and hospitals. But you're absolutely right, it has been unprecedented. I can say from my lens of having done this for over a decade and having worked with the 400 plus licensing boards at the state level, that has probably been the biggest challenge. One, getting those various licensing boards to recognize telehealth as an appropriate way of permitting care. Pre-COVID, all 50 medical boards in all 50 states, including the District of Columbia, recognized video as an appropriate way of seeing, diagnosing, and treating one's patient. There were some other modalities that were questionable in other states, whether it be purely audio or whether they be text-based or some kind of a online questionnaire, whether or not that was permissible. We're starting to see states now offer some temporary relief, if you will, or waiver for healthcare providers to use some of those other modalities, just given the sense that not everybody may have a video-based platform, but may need to connect with a provider they already have an existing relationship with to refill medications and have that kind of 90-day stockpile of medications that you may routinely use. Or just to have access to healthcare providers if you don't have access to video-based platforms. So there's that one thing. I think the other thing that folks are now starting to recognize is that we have a country filled with 50 different countries. Our states have their own state laws and state licensure laws, which permit the ability to provide healthcare across state lines to those who need it, can be very, very challenging. There are numerous entities who have created compacts similar to that of your license. Your license is actually a compact agreed to by all 50 states that either agree to expedite the licensure process, agree to mutually recognize your license from other states pre-COVID. And so that kind of allowed our practice to kind of engage and leverage some of those compacts as we were employing nurse practitioners and physicians and psychologists. Now that we're in this kind of heightened emergency disaster space, we've had over 50% of states waive some of those out-of-state licensure requirements. So either through an application process or by virtue of just kind of an order of a governor, essentially stating you are permitted to practice in this state temporarily. Maybe it's 10 days, it could be 30 days, it could be 60 days, but for the duration of that particular state's emergency duration period. So that certainly has allowed for us to be able to practice across state lines a little bit more easily, temporarily, obviously, but as we're identifying key hotspots and key states where folks are presenting with symptoms or signs for COVID and needing to quarantine at home, or again, folks just needing routine care, and that includes behavioral health, and there being a shortage generally of primary care providers or of behavioral health providers, and us being able to provide the level of service to them if and when they need it in a 24/7 capacity. So some of those state laws have been great. From a reimbursement perspective, again, the investment from the federal government, whether it be the FCC and their $300 million package to support just overall broadband support and connectivity for healthcare, but the ability for now 38 million Medicare beneficiaries. And again, those are my parents and people's grandparents. The fact that you can expect that you can now see either your own healthcare provider or another healthcare provider who can then send your records to a specialist if necessary with your permission without delay, I think is pretty incredible. And the fact that you now have a significant number of them who aren't going to have their claims denied because they're at home receiving care or because they happen to live in a non-rural area, I think is pretty unprecedented. It took 20 years for the acts of Congress and the acts of the administration to remove some of those geographic and patient barriers. Just a few other things I can just kind of spattle off a little bit. It's important that we not overlook the many millions, I believe it's between 60 and 70 million individuals who are presently enrolled in Medicaid. And knowing that 50% of folks who presently get their health insurance from their employers, and knowing that that number is probably going to be dropping significantly over the next few months, I think that we can anticipate that Medicaid enrollment is going to increase by about 5 million, which means additional stress on states, additional stress on healthcare providers who support those vulnerable and low-income populations at the state level, and ensuring that all Medicaid entities are covering telehealth. Many of them did, if not all of them did before, but making sure that they're also covering telehealth to those patients in the home with no issue. So that's certainly something that we're keeping our eyes out on as well, just the difference, the variation in where folks were receiving health insurance, if any, and who will kind of take up the mantle of covering important healthcare services delivered virtually if they happen to transition from employer-based coverage to no coverage at all, or having Medicaid as a program cover them as well. It's been crazy. I know that you mentioned a little bit some of the interesting regulatory barriers that have been listed in healthcare that maybe existed before. Two really notable ones come to mind. In the past year, we were just kind of starting to see the light of day with the opioid epidemic, federal government responding to it, many state governments responding to that. And there were some pretty big enforcement decisions on the part of the Department of Justice and DEA on how you could or could not prescribe controlled substances via telehealth. Essentially, you needed an in-person encounter in order for that healthcare provider to then use virtual services to prescribe. The DEA is now saying, you know what, we are temporarily going to look the other way. We recognize that there are many Americans who are going to need access to some kind of controlled substance, either to help them with their substance abuse treatment, or Americans who have other serious mental health issues for which they will need some kind of a controlled substance to assist them with a non-substance abuse treatment, if you will. If you think of a kid who's been diagnosed with ADHD who might need a stimulant in order to go about to adhere to their care plan, the DEA is now saying temporarily we're going to look the other way and you don't need an in-person encounter. You also have states responding to that too and saying, you know what, not only do you not need an in-person encounter, but we're going to permit the use of phone in order to make sure that there's continuity of care for many of those patients. I think the one big thing that surprised all of us is when the Office of the Civil Rights decided to look the other way and said, you know what, we're going to temporarily waive any HIPAA violations or any penalties related to violating HIPAA security and privacy laws. Again, it's I think folks recognizing that not everyone has an adequate video-based system, and many healthcare providers had to use FaceTime or Skype or some kind of more commercial platform in order to connect with their patients. And so I think that we've certainly seen federal governments in an unprecedented fashion look the other way when normally they would be typically hawkish in this sense.
That's interesting. So while we're seeing some increased level of enforcement on some rules, like people being dragged off of a bus, on the other side, you're seeing relaxation of other sets of rules. And I mean, it makes me think a lot about the people who are not part of the system, you know, the homeless or the indigent or people. So like, and I don't think there's a lot of consideration being taken for individuals like that. But I mean, but it's heartening to see to hear all these things that you're saying. Those are some really big changes, and thinking about how those changes, what will happen afterwards, and how we'll transition back.
Yeah, absolutely.
You know, I think for, you know, I'm a scientist, and so I get a lot of questions, epidemiological questions about what's going to happen with the coronavirus. And I don't have an answer because I'm not an epidemiologist. I'm a data scientist, and I'm a sort of a computational biologist. But, you know, I think that there was when people do ask me, I send them to go watch an interview that Trevor Noah did with Bill Gates, which I think is probably right now the best amount of information that you can get. Right. My English was terrible. My Columbia, I think I just have to throw my Columbia degree in the garbage for the way that I just spoke. But I do recommend it to anybody who sees it. But what Gates did was really showed a sense of leadership, right? It was really evident of his the leadership that he's taken, especially in infectious disease. So with that in mind, you know, I think a lot of times in times of confusion, we look to leaders and experts to help guide our decisions. And so, so what kind of leadership or operational lessons, Naz, are you learning right now during this time that maybe you hadn't learned in the past, that this situation has caused for you to sort of think about? Oh, Naz is muted. Oh, wait, we can't hear you. You're muted. Oh, you can't hear me either?
I figured it didn't allow me to unmute myself after I muted myself. Sorry about that. Things I've learned about leadership. I mean, I think that every day I'm learning still. I've been a founder for like 16 months, so I wouldn't consider myself a leader in that forefront, but I do think that I've led with a sense of heightened transparency. I think that every decision that I've made for the company, I've brought my team along with, and I've also brought our customers along with. We were incredibly transparent when we decided to shut down the clubhouse. It was before the New York City pause started, so we were kind of ahead of the curve in that regard. And we basically, you know, put out a message to our members and our community at large, just saying, you know, we think it's more important that we keep you all safe and sort of take a step back from this and kind of lose a little bit on the business side, right? Like, I'm going through our models freaking out because I plan for a recession, not a pandemic. Definitely not a pandemic where people can't gather around a business, in which case you need people to gather. And so I was doing a lot of brain work and had a lot of fears about what this meant for the future of the company. And I think I just leaned into being transparent about that and kind of, you know, making decisions alongside my community versus in a silo, which I think as a founder, you can often find yourself sometimes there. That's probably the biggest one. I think, again, the other thing is just taking every day as a new day and trying to be nimble and grab at everything. And every small idea, I'm like, let's blow it out and make it a big idea. You know, everything's sort of on the table now. And I think most founders have that kind of heart and energy. It's just happening amid so much loss and sadness and anxiety and all these other things. And so I think being understanding that that's happening at the same time is important. And so trying to do lots of things, but I think we all are, I don't think anyone was totally prepared for this. So one day at a time.
Yeah, I mean, as a fellow CEO, I mean, I really think that it's part of our role is really to manage the values of the organization. And so, like, how do you sort of balance this new value system? How about you, Jared? What are you seeing from your portfolio companies in terms of like shifts in the way that people are leading, or how are you helping your portfolio companies think about their leadership during these times of change? Which is, I think, a very important time for a leader to sort of step up. And you're muted, by the way, so you may need to unmute yourself. Are we having technical difficulties? He can't unmute himself. So I don't know.
Oh, here we go. I think only the moderator can unmute us. So
I'm not the moderator.
So I think being CEO of a tech company is really hard, even when times are good, as they have been for the last 5 years. It's still an incredibly hard job. And of course, in a time like this, like it just only gets harder. We have CEOs grappling with all kinds of things that they never thought that they would ever have to grapple with. CEOs having to do huge layoffs and figure out how to handle that, figure out how to keep their remaining employees motivated and happy, having to deal with employees whose lives have been totally disrupted from this. There's been a lot of great advice sort of on the internet, in our community, on the public internet as well, about how to do those things. But like all the advice in the world doesn't make it easy to do. It's still really hard to have to lay off employees that you've like worked to recruit and retain for years. But the thing that I'm really proud of is the extent to which founders have stepped up and have taken on challenges that they never thought that they'd have to face. Ones like what Naj had to do, where they had a whole plan that was based on how the world worked before, and sort of on a moment's notice, they had to like rip up the plan that they had been working on for years and write a whole new plan like from scratch. We've had tons of companies that have done that in the last month, and a lot of them have like reinvented their business completely. And I think it's really sort of a true test of a leader, particularly at a startup, to be able to be nimble and flexible like that, and to not get demotivated in the face of this kind of adversity, but instead to like rise to the challenge and just like figure out a way to succeed anyway.
Yeah, there's a really great quote that I read in a book recently. It was like, good things will happen, bad things will happen, prepare for both, right? But I don't think there was any way that we could have prepared for what we're going through right now. With that in mind, like we obviously, we now have to balance our lives and our business, in our business lives and our personal lives, so like the work and leisure lives, in novel and interesting ways that we've never had to before. The whole work from home, someone has kids kids are home, and adjusting to the idea of what it means to be working remotely. Thankfully, I've been doing that since 2006, so I've been able to share some of that interesting like failures that I've had and what's worked for me. But I'm wondering for you guys, from either a personal or business perspective, like what's one lesson or coping mechanism or method or tool that you're using now that you didn't use before the coronavirus? So it's something that you're like, some way that you're adjusting to life in this sort of currently new normal, right? That you haven't really experienced before. Latoya, are there anything that you're doing for yourself that's like helping you cope or helping you survive or helping you adjust to the, I'm assuming this huge ramp up on the business side?
Yeah, no, that's a great question. We are similar to that of a hospital. We're 24/7 virtual practice, which means that we provide care 24 hours a day, 7 days a week. So there's no lag time. This is probably the busiest that I've ever been as a public policy and government affairs professional in my entire career. And with information, with very interesting information coming out on a daily basis and having to sift through that to determine what we can rely on and what we can't. I've had to find moments in my days where I just say no and just unplug. And even though I know that there's still information coming through my inbox, or there are text messages or people trying to reach me, or voicemail, there's got to be a time where I'm just not responding to that. And kind of just give myself a time during the workday and then on the weekends where I reclaim my time and do things that make me happy. Also finding times for some fresh air, realizing that working from home and needing connectivity, I'm inside a lot, but I respond better to some sunlight and fresh air. It makes me do my job a lot better. I'm super grateful. I know that there are a lot of folks who just don't have the same kind of circumstance that I do, but super grateful that I have an employer that allows me to work from home. I think this is the first time that as a company, we've been purely virtual, not just on our clinical side, but our Inc. side as well. All of the employees working from home too. And so to have their support, but also to have them support us by permitting us free virtual visits through our employer has been great. It certainly does offset some of the other benefits that we get, but having them as a trusted telehealth provider has helped as well. So those are some of the things that I've been able to do to cope over the past few months.
And how about yourself, Naj? Are you doing do you have any sort of personal tips that you're using to help you cope that you might be interested in, or maybe things that you've heard from members of your community that you're like, oh, wow, that's a really good tip. I'm going to either, maybe you haven't rolled it out yet, but you saw it and you're like, this is the best thing that I've heard so far.
The running joke on my team is that I'm really good at building wellness within communities, but I'm so good at it that I am terrible at it. I'm always preaching that your mental health is incredibly important, and in the clubhouse there's dedicated space for it because it should be a routine part of your day, and yada yada yada. Mental health is great, and I don't listen to my own words. I've gotten better about it. The one thing, I haven't done a great job of unplugging, and I'm really jealous of you, Latoya. I'm working on it literally every day, but the one thing I've started doing is I don't look at my phone when I wake up. I've learned that it makes me tackle things in from a position of fear and anxiety versus growth and strength. And so because I read the news and I'm like, everything's on fire, we got to do something. And then I go into our stand-up meetings with that kind of energy, and I don't think that it helps anyone. And so I've cut that out of my day. And so I usually show up at stand-up happy and in a good mood. And I think that's the biggest thing that I've started doing. But I am trying to bring in more wellness practices of all kinds. I'm really willing to try. I just ordered a paint set. I don't know. Someone suggested it and figured I'd try it. That might be my thing. But I'm trying to be more open and into enforcing it into my day.
Yeah, if you and I are the same, my calendar looks like I lost a game of Tetris. So what I've actually tried to do is actually schedule on my calendar specifically an hour or 2 half-hour sessions where it's just you can't book I can't book anything on my calendar. No one can book anything on my calendar because I've dedicated that time to, re-energizing, doing whatever it is that I want to do, whether it's exercising for a few minutes or cooking something or whatever. Right. I found that for me, it's just making sure that I put something on my calendar, because I'm like Latoya, where I've gotten insanely busy. I mean, I've been an entrepreneur for a really long time. This is not my first company, and I work a lot, but this is probably the hardest I've ever worked, ever, because of just sort of all the inbound and outbound work. And then at the same time, our team was growing. So I feel you on just trying to find that time. We did have a question from the community that I wanted to ask, and this may be, and Jared, I'm sorry I didn't ask you for your personal tips, so if you can add them in. But so how should founders who are preparing to fundraise best pivot? What are some of the ways that they can sort of think about that? Because I've been hearing obviously for everyone, there's this sense of uncertainty, and that sense of uncertainty is not just for founders, not just for employees, but also for investors. So what kind of advice do you give to those individuals?
For founders who are looking to fundraise now?
or we're preparing to, or like, they made it started in saying, okay, we're going to start ramping up in December, and then boom, right? Like we're in the middle of the fundraising, and everything went haywire.
Yeah.
Or starting in, right? Or starting next month or in 2 months.
So here's the advice that we've been giving to founders about fundraising. I think fundraising is definitely going to be harder than it would have been a few months ago. I mean, duh. But I also don't think it's going to be impossible. The way venture capital works is VCs raise large sums of money that they are then committed to invest over a period of time. And those funds have, by and large, already been raised now. So like the VCs already have the money and they're going to invest it in some startups. Because of that, venture capital tends to be not quite as cyclical as you would expect. If you look back to 2008 to 2010, the last recession, a lot of people thought that VC was just going to fall to zero, and it didn't. It fell a little bit, but it actually didn't fall that much because of this sort of like committed capital issue. And so I don't think we're going to see venture capital like fall through the floor and like no companies will be able to raise money. I think because the world is so uncertain now, like VCs are moving slower. They're not being as aggressive chasing deals. They know that they can take their time, and so you should expect that your fundraise is going to take a lot longer than you probably planned that it would, and that you're probably going to have to talk to a lot more investors. I think entrepreneurs should also assume that if they were planning to raise, X million dollars before, it may be hard to get to X. So they should think about if they can raise a little bit less at a lower valuation and run their business more capital efficiently and try to hit some more milestones before raising a large amount in the future. And I also think that because the world is so uncertain, that founders should be thinking of contingency plans. They should be making scenario plans for what happens if COVID does last for 18 months, for what happens if there is a huge recession as a result. How can they get to cash flow break even? How can they not be dependent on investors to fund the next round of their company? Obviously, we hope that won't happen, but I think it's prudent to have those contingency plans.
Yeah, it's interesting. I mean, you look back at the companies that were actually born out of the recession, the last recession. I mean, they're some of the biggest names today: Uber, Airbnb. I think you guys were early investors in one of those companies. With the last couple minutes, there's if anyone has a question, you're welcome to post it. But I have one last question. So there's a lot of optimism and pessimism around the ideas about what the new normal of healthcare or technology is going to look like post COVID-19, right? The new world. What are we going to have, a TSA or Homeland Security response? I would assume that we're going to have that equivalent of September 11th. But can you share your thoughts on what you would like to see? Not what you think it'll be, but what you would hope it will be, or what Lutfi, I'll start with you. How would you like to see the world look afterwards?
That's a great question. I guess I could start off by saying I would really love the world as we're rebuilding, because I think that we're going to have to rebuild. Healthcare is recession proof, but we're going to have to rebuild our healthcare system because I don't think that there are going to be a number of practices or hospitals, rural health clinics, FQHCs that survive COVID. So we'll have to rebuild for sure. But I would really love to see that rebuild being done in the eyes of the patient. It has been reassuring for us as a virtual practice to see the fact that our post telehealth visit surveys that all patients get, it's a 5-star essentially kind of survey. We have not dipped below 4.9 since the start of COVID. Our ability to do telehealth related assessments for patients who present with COVID, which I think is reassuring that they like it, they want to keep it, and they expect it. With that said, I think that we're going to have to figure out how to rebuild our healthcare system, not just with telehealth and virtual care in mind, but with a patient-centered primary care healthcare system, if you will. We've got to figure out how we remove specialties from the center of our healthcare system and really make routine care, and that includes behavioral health, at the center of healthcare, if you will, but doing so that enables virtual care as well. I will add one other thing that's not really healthcare related, but it's as an adjunct. We have got to figure out, as we rebuild things, how we ensure that those with benefits get the types of benefits that they deserve and don't fall through the cracks, and those who are working get the kinds of labor protections that they also deserve, so that we're not having to repeat some of the same mistakes that I think that we're learning from this particular COVID period. There is a lot to learn about how to do appropriate outreach and education to patients, especially those who are disproportionately affected by COVID right now. We ourselves have a practice for which we employ 20% of our physicians are African American. That's 4 times the national average. About 60% of our physicians are females. That's only 30% are in practice are females. We are employing our healthcare providers intentionally because we know what the world looks like. And so we're prepared for COVID, but we're also prepared to service patients post-COVID.
That's awesome that you're you're working to ensure that your workforce is representative of the population. I don't think that there are enough companies that really put that as a primary goal of their organization. So that's really, we applaud you guys, what you guys are doing.
Thanks for that.
How about you, Jared? What can you share on your thoughts on the world you'd like to see after COVID?
Well, I'll give you one, Andrew, that's related to what you were saying earlier, which is that we've seen that when it has to, the FDA can move at unprecedented speed and can roll back rules and regulations that ordinarily make drug and diagnostic development be incredibly slow, particularly, and expensive, particularly for startups. And we've also seen sort of on the healthcare side that there's lots of complicated rules around state licensing and reimbursement that when we have to, we can just get rid of. And so I hope that when this crisis is over, we don't just like put them all back, but we take advantage of this sort of great experiment that we've had to run to see what the healthcare industry is like without all these rules and be more strategic about which ones we decide we really need.
Yeah, I think that's a really interesting point, and I think it sort of mirrors what LaToya was saying, where we have all these stakeholders in the healthcare system, but really, we need to be thinking about the customer, who is the receiver of the care, who needs the healing, or the people who love them, right? Who also need that support. And I think it's really great to see these barriers coming down. We're obviously seeing barriers coming up, but I think it's a really great point. How about you, Naj?
I think mine is very similar to what Jared mentioned earlier, which is seeing people sort of be resourceful and work together. I've always obviously been pulled towards community, and to see it happen under these circumstances is not ideal, but you can kind of see like when everyone puts their mind together and efforts and their heart, that really great things come out of that. In our community, people have shared job postings or really all kinds of things. They're the number to their therapist. It's been very humbling and inspiring to see if you give people those kinds of tools that they can build something great.
That's awesome. Thank you so much. And thank you guys. Thank you, Jared, Naj, LaToya for joining, and CVC for putting this on. So with that, it's 2 o'clock. We hit it right on the button. So thanks everybody. Have a good one, and stay healthy and stay positive.
Thank you.